Yes, I agree with you. It's very confusing these days. Too many orthopedic manual therapy courses, and we don't know exactly which one is the best for us as a clinicians. I think the answer for this question is quite simple. If we understand the term orthopedic manual therapy from the research and from the modern clinical practice, we can select the right training course for us as a clinicians. Simply, OMT is the ability of the clinician to select the assessment process in which he can easily exclude any serious problem or what we call red flags. And then, according to the mechanism of injury, according to the behavior of symptoms, he can set a problem list. Based on these problem lists, he can select a treatment procedures in order to help these problems. And what we know very well from the research, any treatment must include what I call the golden triangle. The golden triangle must include pain neurophysiology education, where we teach our patients what's pain and how this pain can change according to the patient perception of this pain. And too much pain not necessarily means too much damage in the tissues. So through a comprehensive process of education, we can actually minimize the patient perception or decrease the patient focus on pain, which will consequently increase the natural painkillers within the body and give the patient this kind of natural sedation. The second element of this triangle is selection of very specific exercises. These exercises are carefully selected for this patient according to the state of healing and according to the patient's functional abilities. These exercises should be very specific and highly functional in order to help the patient to do them in a regular basis. I'm sure you know that if you give your patient too many exercises, you might end up with your patient doing none. That's why your ability to select these exercises is a very important skill that we all as a clinician must have. The third element of this golden triangle is the application of carefully selected manual techniques when necessary in order to improve the tissue mobility, either the neural, the arthrogenic or the myogenic tissues, which will actually complement or actually will help the patient to get immediate effect, which will help his understanding of the pain neurophysiology process, because simply we as a human, we need some kind of visual evidence. So if you keep talking to me about pain is not necessarily related to your tissue, and your pain will go away if you start moving, and on the same session you give your patient some hands-on treatment that decreases the pain, I think this is a strong evidence that will help the patient motivation to do the exercises at home. These techniques should be based on a very sound clinical reasoning framework. So simply, this is a process. It's quite simple. Clear assessment to make sure that your patient is safe, clear assessment that will guide your treatment, and then treatment procedures that tick the main three boxes: hands-on pain neurophysiology education and exercise therapy. Within the orthopedic manual therapy certificate, we include all these three elements. We try to make our teaching very informal, based on discussions, case studies, many scenarios. The learning environment is very informal, and maybe this is one of the reasons why we have organized these courses over 50 times since 2014. This year we celebrate OMTC, or Orthopaedic Manual Therapy Certificate number 50, that will be organized in Dubai. But also we have other programs running on Jordan, UK, Egypt, Saudi Arabia, and Kuwait, and Qatar. If you need more information about this program, if you would like to join over 1,600 physiotherapists and medical doctors worldwide who have attended this program before, you can visit our website www.omtae.org, where you can find all the information about this program, and you can communicate with us if you have any question. Thank you.